Welcome to the Permian Strategic Partnership Podcast. I'm your host, Krista Escamilla. Hello, everyone. Welcome to this week's episode of the Permian Strategic Partnership Podcast. We are so grateful that you are here spending time with us, and we are grateful for the hard work you're doing in the Permian. If you're watching or listening, that means you love the Permian Basin as much as we do. And the goal of this podcast is to share all the good things that the PSP is doing, but more importantly, the good things our community partners are doing. Community partners like Janell Taylor, and she is our special guest today. Janell is the Regional Director for the Permian Basin Counseling and Guidance. She is also a licensed clinical social worker. Janell, thank you so much for being here, and thank you for sharing your time today.
Thank you so much for having me.
We're going to start off with just a little bit of your background, Janell. What was it that made you go into the mental health sector, and what is it that you love about your job?
Going into the mental health sector started from kind of in the beginning of community college, becoming interested in brain health and cognition and neuroscience and finding that absolutely fascinating. And then got to spend many years raising my 4 beautiful daughters and building a business. We were self-employed for many years. And during that time, the mental health was gaining momentum in our society as becoming more at the forefront, right? So
Right.
the interest never waned. And I have a dad who was a 25-year Army veteran who spent 3 years in Vietnam. And there were things we just couldn't put a name to. It was stigmatized for so long.
Right.
And I lived in San Angelo, Texas, and they rolled out 2 new programs, one that offered neuroscience, one was social work. So knowing that I probably wasn't going to have a career in neuroscience, I enrolled in both programs. And that's how I came to have my an MSW, which led to becoming a licensed clinical social worker. And it's been a beautiful second career. It's been my privilege also to get to do this in the Permian Basin, especially in New Mexico. I am from Artesia. So I was living in San Angelo when all this came to be, but the opportunity to come help expand mental health services in the Basin is just my absolute privilege.
I love that you get to do that in your hometown. I know that makes it even more special for you as well. Maybe you could take us through a day in your life of what you do and how you were able to help, especially the rural communities, because we know mental health care is so hard to find even in big cities. So I can imagine in smaller cities, it's hard to find those professionals to help.
Is, and I will say, if going back just a bit, when the Permian Strategic Partnership did the needs assessment and found that, of course, there are healthcare gaps, but especially mental health care, and how our organization, West Texas Counseling Guidance in San Angelo, came to be a part of this was because PSP and FMH put out this grant opportunity in this initiative, and it's grown wider and larger than we ever expected. And I wasn't in on the original grant talks, but I've been in the organization and in this program and initiative since the summer of 2021. And I've gotten to see how it grows. A day in the life, every day is different. It is a lot of becoming a part of these communities. And I work in all of them. We are in Carlsbad, Hobbs, Artesia, and Jowl. And so I'm never sure which day, which town I'm going to be in. But what I love is there's a lot of similarities, but each community has its own personality. And getting to be a part of this mental health journey means, in these small communities, means building relationships, community partners. None of us are supposed to do it alone. So internally, we have an amazing team, but it also takes teamwork throughout your community. And that's something that these small communities are really good at. Our United Ways, our other social service agencies, healthcare partners, people, when we came to town in 2021, so our organization will have its 50th anniversary next year.
But that's fantastic.
Yes,
Congratulations.
so proud of that. Thank you. But as far as our footprint growing into the Permian, we're still fairly new, 4 years in. And in those 4 years, we've been able to provide over 20,000 counseling sessions to
Wow.
residents of the Permian between Texas and New Mexico. And that's through the hard work and dedication of our clinicians and our staff, support staff, and our partners.
I love that. I think that's fantastic that you're able to reach so many people that truly otherwise would not have the health care that they're receiving. How is it that they go about, obtaining the services that are available? Is it a website they go to? Is it a specific hospital? Or how do they go about benefiting from the care that you give?
Thank you. Yes, we do not require a referral. But of course, a lot of the individuals who we see do come to us after maybe seeing their primary care physician, and maybe it's determined in one of those appointments that mental health care might be a good fit for them. So that is one way. The other is to contact us by phone, by email. Our website has all of our forms online, and that's another way it can all be done there. It is so self-referral is how we see the most of our clients. So it's an easy process. And part of being a nonprofit and what we do is that we're always talking about how do we break down barriers? And one of those, of course, is financial barriers. So we offer a sliding scale, and that means even to copays, because in mental health care, it's different than seeing a specialist like your cardiologist that you might go to once or twice a year. In mental health care, oftentimes you're seeing someone weekly. So if your copay or you haven't met your deductible yet, may be something that would prevent you from seeking and accessing that care. So we make sure
Right.
we're always working with people to get them in.
I'm glad you said that, because I think that's important, because a lot of time we don't spend the money on ourselves, especially you're a mom of four, I'm a mom of four. We always are giving to the kids, right? Or to, necessities of life. We don't think of spending that money on ourselves. So that might hold people back from obtaining your services. But what you're saying is you work one-on-one with each individual, correct? And there is a cost-effective way to still to get the help that they want and need.
Right. And we've come a long way. Insurances are more apt to pay for mental health care than even, say, 10 years ago. But again, that's why we say, we take Medicaid and Medicare and third-party insurances, but we also understand that even with really good insurance, depending on your family size or your income, it still make it out of reach. And we want to be a part of getting you in the door if you need mental health services.
Let's give that website. We'll give it again at the end, but I just, in case someone right now is listening and they're saying this is fantastic, I know somebody, myself, whoever they would like to give this website out to, and then we'll do it again at the end of the podcast as well.
It is PermianBasinCounseling.org.
Fantastic. Easy to remember. We hope that you can write that down right now. Unless you're driving. If you're listening and driving, don't wait till you get to where you're going. Let's talk about some of the challenges. I'm sure the challenges of rural compared to city are a little bit different. What are some of the challenges, and how have you jumped those hurdles and made this a successful program?
Part of it was, I think, in the inception of the grant, there was a perception that people would be more apt to do and willing to do telehealth. I think, and I can only speak to, I don't have data to back this up, but anecdotally, it seemed that people had screen fatigue through COVID and wanted that. We've been isolated, and we already know in rural communities, that's one of our something that we have to really work and to protect against is that isolationist feeling. And so then COVID increased that. So having in-person services, originally we were only going to have one center in Carlsbad, but the communities, as when we sat down at the table with local leaders and community partners, we realized in person is what we need. And especially for our littles, as I said,
Yes.
in one of our playrooms, therapy with a 5-year-old on telehealth is hard. So being able to kind of pivot and realize, oh, we need to have centers in these small communities. And if you're coming weekly, that's another thing we want to break down transportation barriers. If you're trying to get your 5-year-old to therapy and you need to drive 30 miles or 60 or 80, that's you're probably not going to. Very few people
Right.
can miss that much work or school. So we still offer telehealth, and it's a great option. And we're actually seeing an uptick in that. There's kind of a moving in a different direction, which is great. It helps if you can hop on your phone or your computer at work, at home, then you don't even have the commute time to get to that appointment, and it's still as effective as in person. So I think trying to work with our communities, and in JAL, they've been an amazing partner, the JAL Hospital District and Clinic, where we have space there because it's a small community, but they need that too. And we, it's been, that's one of the ways I would say that we've been able to pivot. And of course, that has been in conjunction with those partnerships. We couldn't have done it without so many of them.
I'm glad you mentioned that there's a shift because I feel like in person would be more effective. Are you seeing a hybrid, maybe of a little bit of, okay, we're going to meet in person to get that connection and that trust built, and then follow-ups are maybe done telehealth, or, maybe twice a month in person, is that becoming more popular?
We certainly see that too. All of our in-person therapists also do telehealth, and very often those clients will see it's in a hybrid model. Mhm.
I love that. Let's talk a little bit about maybe identifying when it's time to see a mental health specialist, because I know this is a tricky one for a lot of people, especially when it is if it's their children. Like I said earlier, maybe you're more apt to get your child help than you are maybe if it's yourself. But maybe if we could identify, when do you feel it is time to step out and get the help that you need so that you can live your best life and heal those parts of you that maybe you haven't addressed in years?
That's a great question, and it is a unique and somewhat complicated because it can be hard to identify that in ourselves. I think
Mhm.
when someone starts to feel the stuck, when you are using tools, because most of us we're using mental health tools and coping skills throughout our lifetime, and learned by observation, learned because we read something in line, or maybe we took a psychology class, and those things we
Right.
can implement in our own lives. But there's a place when somebody objective or somebody, there's something else going on, and it can be a life event. Sometimes it's not that there's some dormant disorder that's been there, it's that there's been a life event that has us that maybe we didn't process in the most healthy way. And sometimes it is something from many years ago. But there is that moment when if you realize that through your own work and through the skills you've learned, you don't feel like you're being able to move that needle. And
Mm.
you see that you think that there is on the other side a possibility of maybe thriving more than you are today. And you're not being able to take yourself over that space. A therapist can absolutely help you do that and work with you. And depression, we know these things are also cyclical. So sometimes people, mild depression, have been able to handle that themselves through, but there may be a point when you just, there's that recognition that a little help might move that along.
I think that you said that beautifully, and I think that stuck feeling. I think that is a great way of saying, and then maybe just really listening to that inner voice too that says, "Hey, maybe I could, benefit from speaking to somebody about these things instead of holding it all in myself." Yeah. I know you're also.
We don't have to suffer alone. Sorry.
Yes, no, I'm glad. Yes, absolutely, and that's the thing. That is, I think, why it's so important to get this information out today, because I don't want anyone to suffer alone, and I know you don't either. As a clinical social worker, you have a love for people. I know, and you would not want anyone to suffer alone. I also know you have a heart for policy, and for that is something that you do as well. What kind of policies have you been instrumental in changing, or where would you like to see policies change in the mental health field?
That is something I would love to be more a part of. And as we know, it's not quick. I would
Mm-mm.
say that educating the community and our partners with being educated what mental health is, what it looks like to have good mental health, and how do we support that in our communities and the impact that makes for all of us, whether it's in our schools, because if our children are suffering, whether it's from a bullying situation or a divorce, a death of a parent, they may be missing the basic necessities of life and are barely showing up at school. We know that learning is not occurring the way we want it to. This mental health plays a part in our education. It plays a part in our workforce. So we know that if you're not dealing with it in a healthy way, you may turn to substance use. Then we have a safety issue on site. So if we can support mental health, then that trickles down into so many different areas of our life and the health of our community. And so as far as policy goes, that's where I'd like to see and New Mexico has just recently passed, and we're trying to stay, PPCG is trying to stay in the know of how they're implementing that. And PSP has been a big part of helping us stay in the know of those policies and making sure that our voices are heard. It looks different. New Mexico is a very large state, diverse in each community's needs. And we want to make sure that those in the urban areas are helping with policy that reflects this Southeast New Mexico as well. It's very important because, as you said, the rural communities, there's challenges that aren't faced by our urban counterparts.
Absolutely. What would the mental health field look like, say, if your wish 5 to 10 years down the road? What changes, or how do you envision it so that you can help more people?
I would love to see it incorporated more in the corporate section and in our
Yes.
schools. Right now, I think oftentimes when we think about our school counselor, we remember them as academic advisors, right?
Yes.
The districts that are implementing more of a social work counseling aspect, I think, are seeing good results. I would like to see our schools pick that up more, that they're there for that in-house support. And then as far as our politicians and things helping us with funding, because right now as a nonprofit, we're on a greater level do we help break down those barriers of financial need, so that people can access these services, because we do know that has the effect on our economy is great. And so that I would just see it more incorporated in our law enforcement. And I'd love to see that support for them in not only in-house for them in our first responders, but that maybe we join together with them in responding to calls, because we know that that is a gap in our society, that oftentimes our law enforcement is called on mental health calls because that we don't have a group or a program, or most cities don't, some do, but to help out our law enforcement, our first responders with mental health calls, because they shouldn't just be landing in jail.
Right. I love that you mentioned that. And I love that you mentioned the corporate, education, corporate, because mental health it affects everyone in the community. And so I'm glad that, because in the past there was a stigma, right, about talking about mental health. Let's talk about that. How, the differences you've seen in years, and maybe how we can even change the stigma today of where it's at, because yes, we have made strides, right? But we probably could make more. So what would you, what would you like to see happen there with the stigma?
I hope that the needle's moved. You're absolutely right. But because I'm in this field, I see where in certain cultures, even in familial systems, someone who seeks help that's another one of their barriers, that they have to be courageous. I always talk about it's courageous to make that call to a mental health agency, because we haven't been good about talking about that and normalizing it. At some point, I would love that people understood that our brain is an organ, just as if you went to see your cardiologist, if you went to any other specialist. It is something that is sometimes it gets conflated with spirituality. It gets conflated with not being being able to pull yourself up by your bootstraps. And those are some misconceptions I would love for us to start working to break down and say, there are neurotransmitters, things that are in your biology and your chemistry that you're not supposed to just be able to overcome just by sheer will. And
Yes.
there are ways to evidence-based ways through our mental health professionals to help people with their brain health.
Absolutely. Has there been maybe, and of course we don't want to, break any HIPAA laws, but I just want to talk about maybe a success story that the program that, that you and PSP have come together. Do you have a success story that you can share where you've really found that what you're doing has made a difference even more than maybe even you imagined when this program started or when you started with the program?
Absolutely. There are a number of them
Yeah.
have reached out to say it's changed, it's saved a marriage, it's saved lives. Something that we do is we offer rapid access appointments for those in suicidal crisis, because oftentimes an inpatient stay is not the standard of care that's best for someone who is having suicidal ideation. An appointment outpatient where we keep people in their hometowns, in their communities, so they're not missing more work, which increases their finance. If financial was an issue, now it's compounded. School work absences. So we want to make sure that we're helping be a part of that. And so we know that we've kept people from having to be gone for a week to an inpatient stay because we were available in these communities to see them and provide care in their towns. And so they could go home, and we work with them on safety. There have been, we've helped widows, young widows who had children also who needed to be seen and who would not have been able to afford it. And without the funding, and that is such an important piece of what we do, is she would not have been able to seek the care that she needed. And that those have meant so much, and that the ripple effect of that, because we'll never be able to measure that, but we know
Right.
that when somebody's marriage is saved or they didn't take their life, we know that there's 135, they say, lives affected when somebody takes their life. So we know that lessening that exposure, not creating more survivors of suicide loss,
Yeah.
immeasurable. And I'm so proud of our
Absolutely.
team for all they've done here.
Absolutely. And thank you for the hard work you're doing and your team, because that is so important. That is what community is all about, really, is helping each other. And we are all in this together. If there is an organization that's listening right now, someone that maybe wants to do what PSP has done and help join that effort to really pour into our communities through mental health, how would they reach out to you, or how can they help? Whether it's a corporation or maybe it is, police, fire, how could they reach out to you and get connected?
So I would be thrilled to hear from anybody who'd be willing to partner or even talk about the possibility of partnering. And my name is Janell Taylor. So you call the number, our line, of course, they can get you connected to me. My email address, Janell, the letter T, at pbcg.org. And that would be the best way. And I would absolutely love to do that, because for us to continue to offer these services on a sliding scale, and to offer, one of the other things we do is we offer those crisis appointments for no charge, because when someone calls in suicidal crisis, the last thing we want to do is to be asking them for how they're going to pay for that appointment. We just want them in the door and to help
Right.
safety plan with them and keep them safe. So all those things are things that require funding, and we're so blessed with our generous partners, PSP, PY Foundation, the Maddox Foundation, local people who have just helped us move the needle in our communities.
That's fantastic. Well, congratulations on such a wonderful program and really doing such meaningful work, because I can imagine the how that feels for you going into work every day, knowing that you're changing lives, you're helping people, and there's nothing better than that. So I think that's fantastic. Is there anything? Oh, we do want to give the website one more time because we mentioned it earlier.
The website is pbcg.org.
PBCG.
pbcg.org is our website.
Okay.
Yes.
And we want as many people to go there, read about it, see if you can help, if whether you are seeking some help for yourself or you are seeking to help others, this is a great place to start. And that's the question I wanted to ask you. What would you say to someone that maybe is just now thinking about their mental health journey, how they could get started? What would you say to get started?
If they're just thinking about it, congratulations. That's a great first move. And we're here to walk alongside anyone who would like that help. It is, we have a wonderful team, and I think you'll find it's uh, better than you ever imagined to have somebody who's trained and who's objective to come alongside you for whether it's a short stint. Some people come in for 6 sessions and they're good. And some people need a little longer. And each journey is there. We're here for that journey, whatever that is. And uh, I would say careful about some of the things you see online. Online could be both ways, right? It's wonderful that
Right.
we have so much information at our fingertips. Sometimes it can be a detriment. But I think
Yeah.
most things that you find if you go to a reputable website can help you work through what does it look to have it? Uh, what does a counseling session look like? That, and if you want to know, you can also always reach out to us too, and we're happy to give you that information. There's no obligation. Absolutely, just call for information.
Thank you, Janelle. Is there anything in closing that maybe we haven't talked about today that you thought, oh, I really want to make sure that we get this information out to our listeners regarding the hard work you're doing, the communities or PSP? Is there anything that we didn't maybe mention that you would like to in closing?
In closing, I think the one thing that didn't come up is that we offer our services, uh, counseling and case management to veterans at no charge.
Mm.
That's something we're able to do through some very generous funders. And that's an important part. We provide counseling. That's what we do. We high quality. We believe in investing in our clinicians, and that goes for uh, a variety of things that, of course, that we treat. But suicide prevention and supporting our veterans are really near and dear to our heart. And again, it's about breaking down barriers. Not only are we here, but while we're here, we want to break down any others that we have. And so those are, if you have any question, if any of the listeners have questions about those, please reach out and get in touch so that we can give you the support that you need.
Well, Janelle, you are just lovely, and I have just so enjoyed getting to know you today, and I appreciate the hard work you're doing for our communities. It is such important work, and it is good to hear the amount of lives that you are affecting day in and day out. And so thank you for doing that. We really appreciate you. And we hope that everyone that is listening today can share this with people they love. Let's make sure that as many people as possible can hear all the good things that the Permian Basin Counseling and Guidance Program is doing for our communities. And remember, you can always go online, www.pbcg.org, and seek more information, whether you would like to be a community partner or you would like to talk more about their services. I think it is a great asset to our community. So thank you again, Janelle. We appreciate you.
So appreciate the PSP. We wouldn't be here without you.
Well, thank you so much. And thank you for listening. All of our listeners today. We cannot have a podcast without listeners, right? We would just be sitting here talking. No one would be listening. And so we appreciate each and every one of you. Please subscribe, share, and continue to share the good news happening in West Texas and the Permian Basin. Remember, we are all in this together, and the future lies in the Permian. So let's keep doing the good work that each and every one of you is doing every day. So thank you again, Janelle. Thank you for listening. listening. You make it a great day, and we will see you next time on the Permian Strategic Partnership Podcast.